Bridget's anxiety has been getting worse. She's been having panic attacks, not sleeping well, and she's avoiding going out unless she absolutely has to. Bridget is expressing faulty thoughts that are causing her emotional pain and preventing her from functioning as she normally has done. The social worker is considering cognitive behavioural therapy as an option for Bridget. Today, the mental health social worker is explaining the basic idea of CBT and how it might be useful for Bridget.
I don't know, I just find it really tough getting on trains and trams in the city. I just get anxious.
Well, the reason I brought you back today was I wanted to talk to you about this psychological technique that some people find really helpful. And I thought we could spend a bit of time today just explaining what it is, see if it's something that you might find useful, yeah?
Yeah, sure. Yeah, that'd be good.
So it's called cognitive behavioural therapy, and it's really developed by the psychologists. And it's actually not that complicated, but I'll go through it with you. It's basically a technique that really has a look at the way you think about things, particularly the way you think about yourself or other people, and how that thinking affects the way you're feeling about things.
Right.
Yeah. So like sort of the central idea of it, often we say it's the way you think affects the way you feel. Right? That seems sort of obvious, but as you'll see, that's an important part of this technique. So I'm just going to scribble that down in big letters here.
Okay.
And I'll give you a bit more of an example of what I'm actually talking about. So it's the way you think affects the way you feel. Okay,
Yeah.
so that's sort of obvious. So how does it all come together? Probably the easiest way to understand it is with an example. Yeah? And we often talk about this concept of the ABC of thinking, okay?
Right.
So an A is an activating event, or to put in simple terms, any situation that happens to you. So obviously we're going through life, be it struggling with the trams or the trains or the way you're relating to other people. We call those sort of activating events or situations. It's a bit artificial, so just sort of roll with it, and
sure.
it'll make sense as it goes. So that's the activating event. And everything that happens to us has a consequence, okay?
Yeah.
In terms of the way we feel. In your case, you said you're getting a bit panicky on the trams and trains, yeah? And also the things that we do, start avoiding going on the trams and trains, yeah? But in between events and what you actually feel and do, there's a whole little thinking process going on. The thoughts, that self-talk in our mind about how we interpret events.
Okay, yeah.
So the best way to explain this might be to give an example, okay?
Yeah, that'd be good.
Okay.
Thanks.
So say there's a lady walking down the street and she sees a friend who she hasn't seen for a while, and the friend walks right past her, completely ignores her, okay? And she feels quite angry, What could she have been thinking, at a guess, for example, that made her feel angry?
Yeah, well, maybe she's thinking, my friend just ignored me. What's going on here? That's rude.
Yeah, so you can see that the lady's walked past, she's felt angry, but there's been a little bit of thinking. She's had to think all that stuff. Why is she ignoring me?
Sure, yeah.
Let's take another lady who's walking past and her friend ignores her or appears to ignore her. But she actually just feels a bit concerned. Her reaction is she feels, she feels a bit concerned. What could she be thinking that has led her to that sort of feeling?
Maybe, I don't know, she might think that her friend must be really preoccupied with something and really worried about something, because obviously she'd say hello otherwise.
That's exactly right. So if you have a look here, you can see that in one case, the activating event, the lady walking past, the friend walking past, caused a feeling of anger. And in the second example, it caused the feeling of concern.
Yeah.
And the lady who felt angry, I think you said she was thinking, why is she ignoring me, and that sort of thought. And the lady who was concerned, she was thinking, I hope everything's okay.
Yeah.
Okay?
Yeah.
So this is a really long way of getting to it, but it's really getting back to this idea of all our situations we're dealing with between the event and how we feel. This is thinking process.
Yeah.
So it takes a little while to sort of mull over that.
Yeah, but I get it. I understand that. It makes sense.
Okay.